Hi, Katie. My name is Shay. I'm a nurse practitioner student at Franklin University, and I will be seeing you today. I see that you are coming in because you are having some weakness and shortness of breath on exertion. It also seems that you have not been in for monthly checkups for a while now. And if I'm calculating it right, you're probably at 20 weeks. So you're in your second, starting your second trimester. Congratulations on, this is going to be big. So congratulations. The reason I am thinking that you might be experiencing these symptoms is because your iron level is low. And looking at our past, lab work on you, I see that your hematocrit is a little low. It's probably about 7. And with you being in your second trimester right now, I am thinking your hemoglobin should be somewhere between 10 and 11 grams. Okay, and normally when your iron is low, there are symptoms, and the symptoms can be shortness of breath, it can be weakness, or you feeling very tired. In some cases it can be the paleness on your skin, or it can be, if you have severe anemia, it can be basically palpitations of the heart. But let me just tell you, this is something that can be very easily corrected, okay? Um, the thing about hemoglobin, right? Hemoglobin is a protein, and that protein is in the red blood cells that are carried to your tissues to give oxygen. So all the tissues in the body need oxygen, and that's basically what the red blood cells are for. But in order to be able to basically, carry the blood to the tissues, we need that iron, okay? And you, being a expected mother, your body needs to produce a lot more blood, right? Which means you're going to need a lot more iron. You're going to need that iron in the blood to be able to transfer that oxygen to the tissues in your body, but also the baby's body as well. Okay, so in cases where we allow, or in cases where the iron level still stays very low or below a range that we want to keep you in, it's possibility that you could have a low birth rate baby. It's also that you could have a possibly premature baby, and obviously we don't want that. We want that baby to stay in there as long as it possibly can until he or she is ready to come out. So I am going to say to you what I am thinking is I want to go ahead and first, we're going to go ahead and draw some blood on you today, okay? What I'm going to do is get a new set of numbers to kind of see where your blood levels are, to include your hemoglobin and hematocrit. I also want to see, basically your iron levels, so we'll be doing that as well. I just want to check your numbers and see if I'm missing anything. Also, another thing that I want to do is we're going to go ahead and prescribe some medication for you. And basically, it's going to be prenatal vitamins. I'm sure that you've heard this from friends and possible family members that prenatal vitamins really do help moms during the pregnancy. Some moms, they may vomit a lot, so they are losing a lot of iron that way. So we want to make sure that you have your prenatal vitamins that you're taking every day to, again, help build up the amount of iron in your body. I'm also going to give you a pamphlet of all the different foods that contain iron in it, that you might be able to incorporate into your diet. The thing is, I want to just make sure in prescribing the medication to you, Are you okay? Will your insurance company cover the medication? If it doesn't, please let us know. We can make arrangements so that you get what you need to have a successful pregnancy. Okay. So let's just do a recap. I am thinking iron deficiency. From the numbers I have, you're a little low. So we're going to go ahead and give you some prenatal vitamins. We're going to go ahead also and get some blood work on you done as well, just to kind of check to make sure that you're okay there. I'm going to go ahead and just do an assessment on you quickly to see where you are since we haven't seen you in quite a while. We're going to go ahead and check the baby as well. I, did hear earlier that you had spoke to your husband about bringing you some ice and that you like ice, and that you're basically eating a lot of ice. And that's another reason why I would say is probably iron deficiency, because when you have low iron or you're deficient of iron, people develop all different kinds of symptoms. And one of the symptoms is ice, eating an enormous amount of ice. And we call that pica, right? Pica is a condition for many people who, are eating, people eat different things, but ice is one of the things that they may eat. So we're going to go ahead and do this assessment on you. We're going to go ahead and look at baby. And then after that, I'm going to send you down to the lab to get your blood drawn. Do you have any questions for me? Okay, let's get started.